Hi, this is Tom from ZeroToFinals.com. In this video, I'm going to be going through thyroid hormones, and you can find written notes on this topic at ZeroToFinals.com/thyroid hormones, or in the endocrinology section of the second edition of the Zero to Finals Medicine book. And you can find flashcards and questions to train your knowledge on this content and help you remember the information for longer at members.zerotofinals.com. So let's jump straight in. The thyroid gland sits at the front of the neck and produces the two thyroid hormones, which are Triiodothyronine, or T3, and Thyroxine, or T4. T4 breaks down into T3 in the tissues, and T3 is the more active thyroid hormone, meaning it has a greater effect on the body tissues. T4 has a longer half-life of around 7 days compared with the half-life of T3, which is around 1 day. The longer half-life of T4 helps to keep the thyroid hormone levels more stable over time. Let's talk about thyroid hormone production. Inside the thyroid gland, there are structures called follicles. These structures are lined by follicular cells and contain a fluid called colloid. The follicular cells produce thyroid hormones. Iodine is an essential component in the production of thyroid hormones. Iodine enters the follicular cells and the colloid as iodide, or I-. Thyroid peroxidase is an essential enzyme in the colloid that oxidizes iodide, or I-, to iodine, or I+. The colloid contains an important protein called thyroglobulin. Thyroglobulin, which is produced by the follicular cells, acts as a scaffolding structure for the production of thyroid hormones. Here's some clinical relevance for you. Iodine deficiency can lead to hypothyroidism, or an underactive thyroid, and a goiter, which is swelling of the thyroid. Antibodies that target thyroglobulin, or thyroid peroxidase, can be found in autoimmune thyroid diseases, such as Hashimoto's thyroiditis and Graves' disease. Antibodies are a part of the immune system that target a specific thing and tell the immune system to attack that target. Autoantibodies target the body's own tissues. Next, let's go through thyroid hormone function. The main effects of the thyroid hormones are to increase the metabolic rate, increasing energy production and expenditure in the body, increase protein synthesis, stimulating growth and repair of tissues, stimulating heart function, increasing the heart rate and the cardiac output, promoting heat production in the body, helping to maintain the body temperature, and enhancing the nervous system activity and mood. Next, let's talk about thyroid hormone control. Thyroid hormone levels are controlled by two structures in the brain called the hypothalamus and the pituitary gland, specifically the anterior part of the pituitary. The hypothalamus releases thyrotropin-releasing hormone, or TRH. TRH stimulates the anterior pituitary to release thyroid-stimulating hormone, or TSH. TSH stimulates the thyroid gland to release Triiodothyronine, or T3, and Thyroxine, or T4, which are the thyroid hormones. T3 and T4 go off to the body tissues to carry out their effects. They also travel back to the brain and have a suppressing effect on the hypothalamus and the pituitary. This is called negative feedback. The presence of T3 and T4 suppresses the release of TRH and TSH. This helps to keep the thyroid hormone levels within normal limits and relatively stable over time. When the levels of T3 and T4 get a bit too high, they suppress TRH and TSH. The lower levels of TRH and TSH result in less thyroid stimulation and therefore less T3 and T4, which brings the T3 and T4 levels back down. When the levels of T3 and T4 get a bit too low, there is less suppression of TRH and TSH, which results in more secretion of TRH and TSH. Therefore, more thyroid stimulation and more secretion of T3 and T4, bringing the levels back up. TSH, T3 and T4 can be tested on a blood sample to determine whether the thyroid function is healthy. Next, let's talk about hypothyroidism. Hypothyroidism refers to when there is inadequate thyroid hormone. Hypothyroidism causes symptoms of weight gain, fatigue, dry skin, coarse hair, hair loss, fluid retention, including edema, which is fluid under the skin, pleural effusions, which is fluid collecting in the lungs, and ascites, which is fluid in the peritoneal cavity in the abdomen, heavy or irregular periods, and constipation. Primary hypothyroidism is where the thyroid behaves abnormally and produces inadequate thyroid hormones. Low levels of T3 and T4 mean a lack of negative feedback on the hypothalamus and pituitary. TRH and TSH are not being suppressed, which results in increased secretion of TRH and TSH. On a blood test, T3 and T4 are low and TSH is high. The top causes of primary hypothyroidism are Hashimoto's thyroiditis, which is an autoimmune condition, iodine deficiency, and treatments for hyperthyroidism, such as carbimazole or radioactive iodine. Secondary hypothyroidism is where the pituitary gland behaves abnormally and produces inadequate TSH, for example after surgical removal of the pituitary. This results in understimulation of the thyroid gland and insufficient thyroid hormones. TSH, T3 and T4 will all be low. Next, let's talk about hyperthyroidism. Hyperthyroidism refers to when there is excess thyroid hormones. Hyperthyroidism causes symptoms of anxiety and irritability, heat intolerance, feeling like the environment is too warm all the time, sweating, tachycardia, which is a fast heart rate, weight loss, fatigue, insomnia or difficulty sleeping, frequent loose stools, and sexual dysfunction. Primary hyperthyroidism is where the thyroid behaves abnormally and produces excessive thyroid hormones. High levels of T3 and T4 act on the hypothalamus and pituitary to suppress TRH and TSH. On a blood test, T3 and T4 are high and TSH is low. The top causes of primary hyperthyroidism can be remembered with the GIST mnemonic. G for Graves' disease, which is an autoimmune condition, I for inflammation or thyroiditis, which itself has various causes, S for solitary toxic thyroid nodule, which is a lump on the thyroid that's producing excessive thyroid hormones, and T for toxic multinodular goiter. Secondary hyperthyroidism is where the pituitary behaves abnormally and produces excessive TSH. This is usually due to a pituitary adenoma, which is a hormone-secreting tumor. This excessive TSH stimulates the thyroid gland to produce excessive thyroid hormones. TSH, T3 and T4 are all high. Let's summarize the blood test results looking at the T3 and T4 levels and the TSH levels. In primary hypothyroidism, T3 and T4 will be low and the TSH result will be high due to a lack of negative feedback on the hypothalamus and pituitary. In secondary hypothyroidism, the T3 and T4 will be low and the TSH level will also be low because it's the low TSH that's causing the hypothyroidism. In primary hyperthyroidism, the T3 and T4 levels will be high and the TSH level will be low because it's suppressed by the thyroid hormones. In secondary hyperthyroidism, the T3 and T4 levels will be high and the TSH level will also be high because this is what's causing the excessive thyroid hormones. Finally, let's talk about medications that are relevant to thyroid hormones. Levothyroxine is a synthetic version of thyroxine, or T4, and it's used to replace the missing thyroid hormones in patients with hypothyroidism, or an underactive thyroid. Carbimazole is a medication that inhibits the production of thyroid hormones in the thyroid gland. Carbimazole is the first-line treatment for hyperthyroidism, or an overactive thyroid. Research has consistently shown that testing yourself after learning a topic has a powerful effect on how long you retain that information. This is known as the testing effect. Studying and then testing yourself results in longer lasting and stronger recall on that information when tested at a later date, even when compared with additional study sessions. If you're preparing for a medical exam and you're not regularly testing your knowledge and practicing your recall, you're failing to maximize your potential. The Zero to Finals members site contains flashcards, short answer questions, multiple choice questions, and extended matching questions that are purpose-built to supplement the Zero to Finals content, helping you build your internal database of knowledge and take advantage of the powerful testing effect. If you like the Zero to Finals notes, books, videos, and podcasts, then you'll love the members site.